Hello, I'm Danny Burgess, Program Director for the Vascular Surgery Fellowship at the University of Vermont Medical Center. I want to thank you for your interest in our program. Because we cannot meet in person, we put together this video to tell you more about our fellowship and, most importantly, the people behind it. This video will introduce you to our faculty who are dedicated to maximizing your potential. Most importantly, you will hear from our two current vascular surgery fellows. At UVM, you will train at one hospital that offers a broad and deep clinical experience, ranging from percutaneous to open and hybrid procedures. During your 2 years with us, you will conduct clinical research, engage in teaching, and complete a meaningful quality improvement project. While nothing can replace an in-person visit, we hope this video has helped you get to know us better. So let's take a moment now to hear from our faculty and fellows.
The history of vascular surgery is long and storied at UVM. The lineage of the section of vascular surgery starts with Gordy Page, continues on through John Davis, Steve Shackford, Dave Pilcher, Mike Rickey, and the current group of surgeons here. As part of this group at UVM, you will be a recipient of the shine of their academic and clinical prowess, and will carry that on in your future.
The Division of Vascular Surgery has been well established in providing not only education to surgery residents, but providing comprehensive care to a patient population that spans across all of Vermont and northern New York.
Coming into the department, there was 6 surgeons when I first started. We're up to 7 right now. The operative volume of those 7 surgeons has been very high and has been very favorable as far as being one of 2 fellows. We've got an incredible operative experience that's very busy and has a wide scope of practice, including a robust open operative experience as well as advanced endovascular experience.
The Department of Surgery on the whole has a reputation for treating its trainees as colleagues. Doesn't mean we don't have high expectations of those colleagues. We still demand clinical excellence, we still demand teaching excellence and research excellence. But we do tend to treat our trainees as colleagues more so than subjugate them to the ranks of servitude. I think it's important for a good learning relationship for that to happen.
And for me, I essentially was treated almost like a junior partner while given the mentorship and the teaching and training that was necessary for me over the course of 2 years. Immediately I was offered autonomy both on the wards as well as in the operating room, and with some supervision over a short course of 2 years, I was able to develop the skills to provide comprehensive care, both medical and surgical, to this difficult patient population.
The dedication that everyone has in the department towards the training of a vascular fellow. Everyone is very invested. Everyone is looking to make you better. They are looking for ways to help you in all aspects of life, not just training, but personal life, mental life, whatever it may be. Everyone here is looking for ways to help you and to get you and make you that competent vascular surgeon that when you graduate this program, you will feel comfortable approaching any scenario.
We are a very busy program. We are the only vascular surgeons in the state of Vermont, and the tertiary referral center for vascular surgery emergencies and complex cases in this region. We have an advanced hybrid endovascular operating room. We work with our colleagues in cardiology and utilize the space in the cardiac catheterization lab to do additional endovascular procedures. And we've had the opportunity to do procedures in procedure room areas that are venous in nature.
You get exposed to a variety of open procedures that you may not be exposed to at other places or as frequently. And so I think that gives you a great opportunity to learn from very experienced surgeons how to do open surgery the way that they were trained to do it.
Now, on the endovascular side, there's only so many places around the country that really do physician-modified endografts as far as endovascular approaches to aneurysms. We also do, obviously, TVARs. We do laser fenestrations of the left subclavian. We do complex endovascular filter retrievals in addition to both transfemoral and transcarotid artery stents. And the fellows are part of everything that we do. So even since I've been here and we started doing TCAR procedures, transcarotid artery revascularizations, the fellows do those hand in hand with me. I think that creates a very unique place to train, as the fellows have been there every step of the way doing these procedures.
The Vascular Laboratory has always been one of the cornerstones within our service. Really, for a vascular surgeon, you cannot work easily within our field without a good vascular laboratory.
The Vascular Lab, we do as fellows, we do a dedicated 2-week rotation. We work very intimately with the experienced vascular techs. We read our own studies, which is required for one of our certifications when graduating vascular fellowship. It's a dedicated 2-week rotation that the program has provided us, and it's a very invaluable experience to have that at a training program.
We have a large vascular laboratory that is built in our clinic. That means that we have close relationship with the technologists to do our studies. We can communicate with them live when they actually are doing the ultrasound and the investigations that we need to be able to do our field. We cannot really easily do what we do for a living without them. So we're very fortunate that we have a great vascular laboratory that works with us and great leadership within the lab too.
Fellows are not only expected, but it's actually part of their training. They must be RPVI certified. This is Registered Physician Vascular Interpretation. So I was actually the first generation through where we had to take this certification test, and it's a requirement for every class ever since. Getting a good education in vascular interpretation is essential. And we do a ton, and it's right there in clinic, and our vascular fellows spend time with these ultrasonographers, learning how the studies are done, how they're read, and it's essential in our practice in treating our patients.
I'm helping to coordinate the vascular simulation experience for the fellows and for the medical students. I think it's wonderful that we have a endovascular simulator, the Mentis simulator, which can help you go through step by step some more complicated procedures like endovascular abdominal aortic aneurysm repair or carotid stenting that we don't necessarily do as commonly from a transfemoral approach. The other great simulators we have are an open aortic model, we have an open carotid model, we have an open lower extremity bypass model, and those are great opportunities for the fellows to take younger junior residents through cases, and it's a great teaching opportunity. It's also an opportunity to practice skills that you don't necessarily do as commonly, things like open aneurysm repairs and practicing different techniques for your proximal aortic anastomosis.
The VQI in its current form is an excellent modality for evaluating risk-based quality outcomes in vascular surgery. But not only that, as one of the founding fathers of the VQI, you'll have excellent access to this database for your research projects and quality projects while you're here. Throughout the medical center and throughout the medical school, you will run into researchers that are currently looking into thrombosis, platelet activity, rates of cardiac events in clinical situations that will help you to not only take care of your patients, but help you to form some research projects as you go through your 2 years here.
If they're interested in well-balanced experience where they get trained in both common procedures as well as complicated rare procedures, they want to do that in a cooperative environment where people are supportive and do that in the area that is gorgeous. We are the place for them to come to.
Well, I mean, Vermont's an exceptional place, and there's a true sense of community that expands outside the medical center with the emphasis on outdoor activities and personal health and wellness.
Burlington's got this incredible food scene and incredible music scene.
Just the scenery is gorgeous, the mountain, the lake. It really is a wonderful place to live.
Thinking about what I wanted to get out of a vascular surgery fellowship, I wanted a very busy service that had a robust, open operative experience that didn't compromise on any advanced endovascular techniques. And we definitely have that here. It's been outstanding, it's been busy. The mentorship has been very tailored, and the mentors are very much invested in our training.
This is a program that is all about teamwork, about patient care, and that's exactly what is displayed here throughout all faculty, the fellows, the residents, the medical students, and the entire hospital as a whole is having that team spirit and family connection. And that's something that whenever you need any help, everyone is willing to lend a hand. So those ingredients are some of the essential components that make training productive, fun, and at the end of the day, somewhere that I want to come to work every day.
We hope that you found this video informative and are excited to meet you. We look forward to the opportunity of training you in vascular surgery and mentoring you along your vascular surgery journey.